Well, hello, everybody. So sorry for the late start. This is Senator Ben Allen here, and I'm just really excited that we have the opportunity to talk about an increasingly important issue that has been raised over the past few years, that of youth mental health. One that I care a great deal about. I served on the school board in my hometown. I served as chairman of our education committee in the state senate, and also on a select committee on mental health. We know that the pandemic particularly presented a whole slew of challenges for our young people that were especially vulnerable as we dealt with the broad impacts of school closures, and physical distancing, social isolation, family loss, instability, unexpected. And we know that the pandemic just exacerbated the youth mental health crisis that of course was already a challenge before COVID. Something like nearly 300,000 youth cope with major depression in our state. Something like 66%, about 2/3 of them, don't receive adequate treatment. And so we have I'm going to talk a little bit later about some of the work we're doing in Sacramento right now, but I want to go right to our panelists. We have an excellent group of panelists who are professionals, experts in the area of youth mental health. And they're licensed social workers who are going to walk us through what mental health trends they're seeing in our youth population and how you, as a caregiver or as a parent or as an interested citizen or as a young person yourself, how you can identify if your child, someone who you love, or a friend or a peer, or even yourself needs help, and then how to assist that person through a difficult time. So today we have with us Nisa Bhatti, who's the director of behavioral health department at the Venice Family Clinic, Jen Amaya Gonzalez, who's the associate director of behavioral health and lead clinician for Venice Family Clinic's Affirm programming, and then Maria Jarquin, who's the supervisor of the school-based behavioral health program at San Siegel Youth Health Center at Culver City Middle School and High School. And I'll pass it off to Nisa.
All right. Thanks so much, Senator Allen. And yes, as you mentioned, we know that our teens have been pretty significantly impacted through the pandemic. Venice Family Clinic. So I'm the director of behavioral health at Venice Family Clinic. We are a series now of 17 clinics throughout Western Los Angeles County and South Los Angeles County. And we are an integrated care organization, which means that patients who have low or no income can receive medical care, dental care, optometry, behavioral health support, all under one roof. And our behavioral health team has grown exponentially. And we're doing our best to meet the needs of folks in the community. We last year served about 6,000 patients, unique patients. And I'm really stoked because I'm here with Maria and Jen, and both of them have their own respective areas of expertise in working with teens. And so we look forward to having a bit of a dialogue today about what we're seeing and how to most be helpful. So Maria, do you want to introduce yourself, and then Jen?
Sure. Thank you for having me. My name is Maria Jarquin, a licensed clinical social worker with Venice Family Clinic, and I direct our school-based mental health programming.
I am Jen, she, her. And as mentioned before, I oversee our Affirm services that are for validating all identities, specifically working with the LGBTQ plus community and gender affirming care.
All right. So as we kind of open this up, what are each of you seeing as some of the more pressing or kind of at the forefront of concern for teens these days, for what teens are experiencing in each of your respective areas? What are you noticing? Themes, issues, challenges?
I think just started to contextualize that question. I'd like to first start by recognizing everyone that's participating, and if you're feeling like your child is also dealing with anxiety, depression, or other mental health concerns, that you're not alone, which is why this conversation is so important. Thank you for being here. Something I hope that we can give families is just the tools to be able to recognize when you're noticing beyond what is typical adolescent behavior and the changes in when you might need a little bit more help. I think it's important to acknowledge the pressure that kids and teens face from having to figure out their future, get good grades, get into college, needing to be superstars in sports, extracurricular activities, really tough schedules that don't allow enough time for rest, relaxation, and unstructured fun, to bullying, whether it's in person, social media, both. And also persistent fears about heavy issues that are happening around our world. The question I get asked most is, how will I know if my teen is struggling? And it's important to note that the mental health symptoms that your child will sort of might be showing are very unique to them. And as a parent or caregiver, you kind of have a good sense of what their normal looks like, but just some things to sort of be on the lookout for is mood swings, irritability, anger, tearfulness, especially if you notice that it's more intense than what is typical for your child, notable changes in sleep, weight, eating habits, loss of interest in things that they usually love or quitting activities that they enjoy, withdrawing from friends more than usual, canceling plans with friends, struggling academically that might seem different or more intense, like for example, failing a quiz in a subject that they are usually excel in, running thoughts of worries that won't leave them alone, whole new sets of friends popping up, signs of drugs, alcohol, substance use, as well as signs of self-harm like cuts, burns, bruises that your teen tries to hide or can't really fully explain. Also, just keep in mind that one of these symptoms doesn't mean your teen is experiencing a full-blown crisis, but just keep your eye on, and if you notice consistently or see one or more of these signs pop up, it might be a good time to open up the conversation about mental health with your teen, and hopefully we'll give you some tools to do that here.
Thank you. And just to add to what Maria is talking about, I think we are aware of just natural developmental changes that will happen with our teens. And so just putting out there that, like Maria mentioned, one or two of these changes might not mean, oh my gosh, they're going into something a lot more severe, but it might just mean that they're changing. And so there's a lot of things that also change just as a natural journey into adolescence from when they were younger. And so this might just be an opportunity to think about what questions you can ask and what ways you could maybe just open up that conversation with them. I will say, in terms of some of the trends and challenges that I'm seeing for the patients that I'm working with, certainly depression and anxiety, stress all around. And also, I think a lot more of some of these instances of self-harm and even just thoughts of suicide because of exploration of sexual orientation and gender and expression all around. And so on my end, with the work that I do, I certainly see a lot more of a need for exploration, and teens are talking more about and testing the waters with asking more questions about what they might be feeling and what that means in terms of who they are and their intersecting identities. And so I think this is not, in my opinion, not because there's a lot more of a need for mental health services now, but actually because now there's a lot more support and even visual aid to support just openness. Like, I'm looking at Nisa's office now and I can see in the back the progress flag. And so all of our patients will see some of that when they come in. And so now there's more of just different indicators, visual ones, the way we speak, our language, that might indicate to a child, a teen, oh, this person is safe. They can maybe speak to some of what I'm experiencing, but also maybe this would be a safe person to ask questions to. And so I do feel like more of what we're seeing is this need for just openness and curiosity for some of the exploration that a teen might be having regarding their identity in general, how they compare to other teens, whether some of the things that they're feeling might mean something, might not, all these labels that they're connecting to. And certainly with our trans and gender diverse population, a lot more surrounding dysphoria and the discomfort that they might feel surrounding just that disconnect between the sex they were assigned at birth and what they currently experience in their body. So sometimes what I'm getting is, I don't feel at home in this body, and that might be something that I want to explore further. And there's some things that don't feel quite right. And maybe I want to talk to some folks about this. And so I think there's always this fear of just rejection and, familial, I think acceptance is not guaranteed. And so certainly a lot of fears surrounding that on top of everything else that Maria mentioned.
And you both kind of spoke to this around the experience of being part of, and what's typical, what's maybe not within like adolescent development. And as a parent of two kids who have gone through adolescence, I can speak to the real reality of there's a developmental process for parents as well, of learning how to let go a little bit more and allow your teen to step into some of their own exploration of themselves. And how do I fit in? Who am I? But what tips do you have for caregivers in navigating how to create conversation with their children, or when to be worried as opposed to, okay, I'm going to just gently notice my child and be here present with my child, versus there's something really significantly wrong?
I think the most important part of that is the relationship building and being attuned to your kid. And no one knows them better than you do. And so, really taking that role seriously and working on how do you cultivate that relationship? How do you cultivate that openness? What are structures and rituals and parts that are very special to just your relationship with your child that will in the future make them more likely to come to you and open up to you. And so the biggest advice that I could give to parents, and it's hard sometimes. I'm a mom of two, and sometimes you hear things and it could be concerning, or even that skill of like self-regulating so that you can be there in that moment with your kid is tough sometimes. But being able to just stay in a very curious stance, so asking questions, being very non-judgmental, not stating your own opinions or thoughts about what they should do or shouldn't do, and just being able to give them that space to sort of free flow with you a bit and kind of figure things out is a really, really good start, and difficult to do at times. I do acknowledge that.
And I'll add on my end again, working with our parents and the teams that are coming in for more affirming approach, which would be, again, validating of whatever they're experiencing in their identities. I think caregivers all around can just be that validating of the fact that sometimes it's just confusing to exist and to be a teen. And so even just going back a little bit to what is normal, just a normal part of development of exploring and being curious about the world and who we are in the world and our role. And so I think from a young age, we connect to these external and messages from, it could be from different systems, from the people around us, from commercials, from anything. And then we internalize that as we grow older. And so I think that when we as caregivers, when folks that are just part of a parental unit can validate and normalize just normal exploration of expression of the clothes that we wear, our hair, different things that we do to show our creativity. I think that can be really helpful for teens. I think that just validating that sometimes life can be really tough and that emotions are not good or bad, they just are, and they exist to communicate certain things too. So sometimes we'll have parents that'll say, I'm not sure why they're crying all the time, or maybe they're really angry. And so I think communication is still happening. So verbally, they're not maybe endorsing, this teen is not endorsing, this is how I feel. Maybe they don't have the language just yet, but they are certainly communicating that something is up. And so that might be a good end, just to sit with that. If it's, oh, I'm here if you need to talk. And if they won't, because sometimes teens won't want to talk, that we could maybe do some other nonverbal forms of support. Like maybe I'm just going to sit here with you, where you don't have to answer any of my questions, but I can certainly join you in this, whatever you're feeling. Maybe we can hug, maybe we can hold hands, maybe I can just check in every so often. You still good? Things all right? And so I think the way that we can support teens all around is just by being there and being just a consistent just persona role that continues to be consistent, so that they're aware at some point, like, well, I know that this caregiver, my parent, is here. I think asking questions, like Maria mentioned, being curious about the experience and not having your own, even though we have our own biases and preconceived just suspicions of what is going on, that we might hold off on that so that they have a little bit more time to get to that realization or to that answer. I think that we educate ourselves, like joining some of these panels and even just looking into some things that might be more helpful. Certainly with the population I work with, anything that could be helpful for our parents, we try to provide them with some information, maybe some language surrounding certain topics and ways that they can reinforce protective factors. So different things that support the teen, so that when they feel stressed or feel a little down, they don't completely go into crisis mode, but instead that they have some coping strategies. And certainly advocating for your teens. If something's going on and you know it's school based, let's say, like going in and trying to have a conversation with the folks that can support that in creating a better environment for your child. And I think also just attending some of these activities or learning more about the things that bring your child, your teen joy, and joining in with them, be more curious about that, because I think we have a lot of teens that their eyes will light up when you start asking them about anime or gaming or whatever. But I think if there's been a distance in the relationship, and that's the one thing that might bring y'all closer together, just to ask a little bit more about this thing that they love, I think that could be a good start.
All right. You know, and both of you also referenced different supports. And I think that that's an important thing to highlight as well, is that caregivers, parents, are not necessarily the go-to for teens. And so maybe there is a teacher at school, maybe there is a counselor, maybe there is an auntie or an uncle, or, you know, a friend of the family that can have that kind of a relationship as kind of a support system for the kids as well. I do want to also highlight that 988 is now in existence, and anybody can call 988 for any kind of mental health support, or just even to call and talk and ask questions of like, is this normal, or should I be worried, or I'm not feeling that great. It's confidential, it's free, it's 24/7. But Jen and Maria, what do you have any like quick tips in terms of kind of speaking to the resiliency that our kids have these days? They've been through a lot. They've been through the pandemic. They've been through so much that none of us went through as kids. So can you speak a little bit to that, and what you see as kind of hopeful points too?
Well, I can start if you'd like, Maria. I think on my end, something that I noticed is that although we do have a lot of teens that especially the ones that were bound to graduate during that time, that had felt the transition into, let's say if it's college or if it's working after becoming now this young adult, that's been really difficult for them in terms of like socialization and all of that process, because they didn't really get to do all that, right? They were just home. And so I think something that has been helpful, you alluded to this, Nisa, before, that just even having this stronger system of support, whether if it's the parents, friends, an online community. A lot of teams develop these online communities that oftentimes I think will get concerns, rightfully so, from parents and fear surrounding like, what's going on in there? Like, who are they talking to? But there are, I think there can be a lot of support in some of these communities that of teens that are also experiencing similar things, sometimes joined by things that they love, maybe if it's gaming, if it's something else, or other. We have many therapists that are practicing even just being curious about that. What has been built in lieu of being able to like actually go out and build these in person relationships, and what has been built online that has supported them up until now, and how can they now replicate that as they move on and transition into having more of these in-person moments. And I think anything that you could be doing, that you could do with your team to support them slowly and gradually, just building a little bit more of their communication and social skills. It might just mean maybe we're going to go to this event together, and just monitoring if that teen is, I think a lot of anxiety plays a role. And so even making a plan for that, oh, we're going to attend this thing together, but you know, if we need to take a little break, or if we maybe need to bring something that you enjoy, like a book or a drawing pad or something, to kind of like get you back to this grounded place while we experience this, and then moving on and knowing that there's a time frame, we can leave at this time. And I say that because of a lot of our teens that are now moving into, if it's college or working, even just leaving their homes was really tough. And so I think having, like, if it's transitional objects, even though that might sound a little bit interesting as they're not like little children anymore, having something that they can, that's sensory, that they can hold with them, things that, again, ground them back. If it's, I just had a teen, well, not a teen, I think 18 to 20-year-old that just has a ring that they fidget with, and that they love to do that as they're having conversations, because otherwise their anxiety gets a little bit out of hand. And so certain things that they can connect to. So learning their pattern and the things that bring them comfort, so that when you do practice and experiment with, we're going to go to this meeting with the school, we're going to go do this, that they have what they need and they feel supported. And it's a gradual thing. So not too much pressure to jump from this point to this other one, because it has been really tough for teens all around during the pandemic.
And I think a bright spot or a positive trend amidst it all is just the willingness of youth to seek out support. I think there's been a lot of work on reducing stigma about accessing mental health. There's been, you know, a lot of campuses that are making youth mental health a priority and talking about resources, or, you know, having wellness centers that focus on both body, mind, spirit of students. And so I think that's been really great to see, and it's very hopeful as far as trends go. And then on the caregiver side, or the adults around these youth, just the interest in understanding mental health and what youth experience, and really starting to open up conversations, whether it's through events like this or in the privacy of your own homes, but just that curiosity and interest in wanting to support and help, just having that out there, you know, encourages people to seek out the support when needed.
I'm really glad you both spoke to this, because I also have seen that if we want to say that there was a silver lining to the pandemic, it is that the experience or the willingness to reach out for support and help is so much greater now. There's such a reduction of stigma against seeking help. And so folks across the age spectrum, I'm noticing, are feeling more comfortable in reaching out for help. And Jen, you alluded to the screen time. I think, there's also that vacillation and some concern from caregivers around screen time and all of that. And I also, through the pandemic, know that that is how a lot of kids connected with their peers, with groups. And there can be value. What do you think? And I know we want to kind of wrap up, so maybe some last quick thoughts for caregivers and for teens in terms of when is it a good resource and when is it maybe too much? If either of you have a thought on that.
I have a lot of thoughts on that. It's actually the second most asked question I get, after the first being, how do I know if my child needs a little extra support? And so what I will say, that the relationship between screen time and youth mental health is complex and ever evolving. And while, like Jen mentioned, social media can offer like social connection, keeping in touch with peers, joining communities that represent aspects of their identity or interest, learning new skills. A student told me the other day they learned how to play guitar from YouTube, express their creativity. There are risks to using screen time and social media, especially unmonitored, and youth are looking to caregivers to help provide some boundaries around this youth, which is uncharted territory for many of us. Top things to look out for is like overload, so using too much of social media and screens, which can push other activities to the side, so leading to sedentary lifestyles, which impacts physical health, reducing that face-to-face interaction, which is crucial for emotional development and support. And then the second is unhealthy content, so which can expose your youth to things way too soon and way too fast.
I think the key is to have this conversation surrounding boundaries and what that might mean, and just I really do believe in having a conversation with the teen. And so obviously whoever the caregivers, have conversations first about like what are our concerns, what is happening, create a plan, but really with the teen, that they feel involved and that the information is shared with them as to why maybe limiting the screen time to whatever extent is seen as a helpful thing. And so oftentimes teens will go, but I don't know why. They just said it's because they said so. And so I think even if they don't understand the reason for it, that a reason be given for like, you know what, this is what we're hoping will be helpful. And maybe we can talk about other activities that are also something that you enjoy that can be done outside of this. That could be also a way of rewarding the collaboration. The other side of things, I will say, I have found really wonderful apps and communities that support mental health awareness and just overall support for teens. There's a lot of apps that focus on journaling, on anything surrounding even productivity, in ways that some of these communities, like Anime for Humanity, for instance, where folks can talk a little bit about what they identify with, but they're also very much talking about mental health and how they can balance that. And so very complex relationship there.
Thank you both. That was an enlightening, illuminating conversation. And I think that there's no way of speaking to all the different facets of teen mental health and caregiver mental health, really, because it is so complex. But Senator Allen, I really appreciate that you even invited us to have this conversation with you, because the more we can talk about all of this and bring it out into the open, the better for everybody.
Well, I appreciate everyone's insights a great deal. I mean, obviously we're dealing with you have to deal with so many different kinds of situations and so many different scenarios. And unfortunately, these keep pinging here, but let me just give a little bit of background as to some of the work that's happening at the state level that I think merits some attention. So first of all, back in 2021, and I'm just for folks to know, I'm literally in Downey right now, about to speak to the LA County Office of Education Superintendent Summit with the county superintendent. We're focused on mental health issues and really doing a deep dive into the big master plan on mental health that the governor put together a couple of years ago. So what built up to that, in 2021, we passed a budget that made historic investments at the state level to transform behavioral services for young people across our state. So that included $4.4 billion statewide for the Children and Youth Behavioral Health Initiative, which aims to streamline services and funding among schools and public health departments and community health organizations, as well as funding staff training and school wellness centers. And so then in 2022, the Department of Education, the State Department of Education, announced plans to add 10,000 more counselors to our state's public schools by providing scholarships and streamlining the licensing process. And then this year, two major measures that passed the legislature that are going to make their way to the ballot in March. So SB 326 and AB 531. Together, Californians will, through these two bills, Californians are going to have the opportunity to vote on modernizing and transforming the state's mental health system. So check out that space as well. It'll be on your March ballot, both a bond, but also some important streamlining, with regards to the way that we do mental health care provision. This year, the state also awarded about over $30 million in grants to 63 different groups around the state, including a number in our area, including, I think, Venice Family Clinic, actually, to support youth mental health through community and evidence-based practices, supporting parents and grandparents and other family caregivers. And so that's some of the work that's happening. The governor unveiled this comprehensive master plan for kids' mental health just last year, 2022, that directs nearly $5 billion for trying to improve mental health and substance abuse services around the state. Broadening Medi-Cal coverage for parent-child services, introducing a new virtual platform to enable digital mental health assessment intervention, and developing a robust mental health workforce by creating more pathways for 40,000 new mental health workers, because that's become a major challenge as well, just getting enough people to provide the one-on-one services, the counseling that we need for young people, that we know the young people need. So there's a lot going on, but everyone knows that there's a lot of inadequacies in our system, and a lot of kids, unfortunately, who've been falling through the cracks. And of course, all these other challenges that we've been talking about have not made life easier for young people. So with that, let me start jumping into some of the questions that have been popping up. The first one actually seems to be one that's probably more directed for me, and I've tried to answer it a little bit, but just to be really clear about it, is the state planning on doing anything to address the shortage of licensed mental health providers? So yes, we are. I just mentioned, that the Department of Education is planning to add something like 10,000 more counselors to our state public schools, by providing scholarships and streamlining the licensing process. But that's just the tip of the iceberg. I mean, as I mentioned, we've got this nearly $5 billion in the state, in the governor's master plan that's going to boost coverage and service availability throughout the state, so that that anyone under 25 will have increased access to mental health services. And this new plan is going to develop, as I mentioned, a virtual platform to increase accessibility. It's also focusing on training, opening the pathway for all these new professionals to join the workforce. And something like $1.5 billion of those funds is earmarked to build out the healthcare workforce that expands our capability to meet health needs of California. So there's going to be a lot of resources in this space, and I'm hopeful that we'll be able to finally solve some of these massive problems that we see manifesting themselves. Everything from increased sadness and depression that many of you may be experiencing in your own homes, all the way to the serious and severe mental health crises that we see on our streets. and I know this personally. I mean, I have a friend who I grew up with, went to high school with, and he's out in the streets, and good kid, but just ended up on a very different path. And I keep wondering, what could have been done to have helped him when we were going to school together that might have prevented that from happening. And it weighs on me a lot. So anyway, I want to just follow up on a few other things that have been coming up on the chat. So screen time. You mentioned a little bit in your conversations, but I would like to drill down a little bit more. It's something I worry about a lot. I've got a little guy. I see how his eyes just sparkle when it comes to a screen, and how focused he becomes, and how hard it is to try to draw him away from it. So how, I know it only gets harder, with teenagers. So can we talk a little bit about screen time and the connection with youth mental illness? What are some tools that parents can have to control smartphone and other tech addiction in teens? Love to hear, a little bit more information about that could be helpful to parents on this particular topic.
Maria, we can't hear you. What I'll say as Maria's working on her mute, is that.
Okay, I got it.
Oh, okay, great. One of the really important things is for caregivers to recognize their own use patterns, because our children model after us oftentimes.
Yeah.
And so, when your child is talking to you, are you on your phone texting? Are you, kind of multitasking that way? And, I think as caregivers, many of us are guilty of that. Instead of putting devices to the side and really engaging in a conversation and bringing curiosity to the table and listening, we also jump right to, screen time as a way of kind of decompressing after a day or whatever. So it is important to look at what we model, and then do we carve out time for connection with our young people that is not screen oriented, because that's important as well. But Maria and Jen.
Yeah, I think some of the things that have already been said, and a couple to add. So I think setting those clear boundaries that Jen was talking about earlier, something that is important is it's much easier to set those boundaries before you sort of approve that screen, whether it's a phone or an iPad, just really having really clear rules and limits around when and where it can be used, and maybe even creating like a daily schedule. Like Nisa said, leading by example is huge. How often do I hear a student complain about their parent taking their whatever screen it is, and then right behind that say, but they don't do it, they don't follow what they're asking me to do. Really just communicating openly. I think Jen mentioned it earlier too, just giving them like the reason of why, having open, non-judgmental conversations about their tech habits, but also being curious, like, what are you doing on those devices? What's your favorite app, games, online activities? I heard of an app where a youth was tracking how many days they're going without self-injury. And, I'm curious if that caregiver knows that that's an app that their student is using. So just being curious about that. I always tell parents, take advantage of the parental controls. They're there for a reason. So use the controls to limit screen time, block inappropriate content, track device usage. Definitely discussing it with your teen and letting them know like why you're doing that is important, and also providing positive reinforcement for cooperation. Designating tech-free zones, so bedrooms, dining rooms, study spaces, places that they can go. And sometimes it's compulsive. And so kind of having a space where you're sort of limiting the screens for them will help them sort of just like release it to you, like, oh, okay, I'm not going to use it because my caregiver told me not to. Because sometimes that self-control is pretty difficult. Also encouraging physical activity, kind of like what Nisa was saying, connect, get outside, you know, engage in sports, arts, other stuff that doesn't require screens. Definitely limit before bed. Don't allow in the bedroom is helpful. We get a lot of students that are sleep deprived, and a lot of like the mood stuff that we're noticing is very much tied to the fact that they, you know, were up chatting until 3, 4, 5, 6 a.m. with their friends. Just monitor usage regularly, and not, remember, it's a balance between monitoring and just kind of allowing that independence. So think less enforcement and just more like training your youth to be able to make responsible choices around social media and screens, not only today, but when they, you know, go off and become adults.
Yeah, I think they
Yeah.
answered beautifully, so I'll just leave it at that. I think it is a balancing act, but I think Nisa and Maria already answered that.
Yeah. Well, there was another question about just why in general. Why do you think that we're seeing these increases in the number of kids with mental health issues? I mean, I think we can all opine on this, but as professionals, what is it? What is kind of, you know, keeping you guys up at night besides your chats? In terms of the increased needs that you're seeing out there with the populations that you're serving.
Go ahead, Jen. Go ahead.
I'll just get it started, but I really do think that there could be many reasons, but I will say, I feel like mental health issues have been, I mean, this has been a thing forever. I believe that there's now more access to services. There is more promotion for conversations that could be had and openness that could be had at school. The fact that, like Maria mentioned, there is more of an effort to have mental health professionals in school settings so that they can engage the students in having these conversations. The fact that people are asking more questions, parents joining these panels, learning about things, and then they go home and maybe inquire a little bit more. I think there's just a lot more information, even online things that kids go into. I've had teens as young as like 13 come in for a therapy session with parent, and while I meet with them individually for them to say, this is confidential, right? Because I read that ethically and legally you can't say. And so they're very they've learned a lot and they can do their own research. And so I do believe that there is just more it's more of a conversation now, I think, and so we're seeing more of it because more teens are wanting to participate in some of these services.
I totally agree with that. I think that because there's more of an acceptance of recognizing that mental health is part of well-being, there is more folks are having these conversations. More folks are acknowledging, oh, you know what? When I feel nervous, I notice a pit in my stomach. You know, so we see it on TV, on ads, everywhere. There's an acknowledgement that mental health is part of health. And so when the stigma, when that kind of dissipates, folks become more comfortable talking about what struggles they may be experiencing or what helps, or, you know, how they've managed situations. And that's, in my opinion, that's the beauty of this era that we're in, is where we are having these conversations, where we are finding community with one another and ways of supporting each other. We don't have to live in these vacuums anymore by ourselves.
All right. Well, there's a whole bunch of questions, and unfortunately, I know everyone's got to jump off. So let me, no. I mean, this is really helpful. And This is just a very specific one that popped up that I think, obviously that some folks, had some issues with some of the trans issues brought up. But I do want to keep it kind of big picture. So let me ask this one question that was raised by someone in the chat, which is, will consultations show up on my child's medical records, or are counseling sessions confidential?
That's a really important thing to think about. So if insurance is being used to pay for counseling, there will be a medical record associated with that. And at Venice Family Clinic, we see patients who are very low income or have no income. Most of our patients have Medi-Cal. We have an electronic medical record. There will be an indicator that a child has seen a therapist in their medical record. The content of that may not be necessarily accessible to a caregiver, depending on the privacy limitations, but there will be a record that a child has seen a therapist if insurance is being used. But Maria, Jen, do you guys want to add to that at all? Of course, the content, though, is not for public consumption.
Right. Okay. And is there any reason for parents or students to be concerned about that? Or have you ever run across any issue with that becoming a problem for a family? The fact that there was a record of it?
I'll say that I think that for the most part, and this is just from just my practice and my work, that I haven't seen that to be an issue, only because I think we do such a good job at having informed consent of what we're doing and what it'll look like and how insurance plays a role in all of that. And so I think when parents bring their children to and teens to have the services, they're definitely in awareness that the insurance and or whatever connection is made when they come to medical visits or mental health visits, that there is that record in it and it's kept. Now, again, we do share the information is confidential. There are other systems that could access that with consent from parent and maybe other ways. But I do think if we have this informed just conversation with the parent about what this will look like and what their concerns are around it, I think we get to a better place where they will think about, well, is this service that I'm going to have for my child, is this one that is worth having, maybe that indicator. But obviously the information we're talking about, even in the way we're noting things in our charts, is definitely not one where we are, it is not like full verbatim, right? We're writing these summaries to support whatever work we're doing, but definitely with awareness of how the information is used.
Right. Okay. Okay. All right. Well, I really appreciate everyone's time. I appreciate all the work you guys do as well. And I want to just give a special shout out to all the school counselors that are throughout the district and throughout the region that are, oftentimes, with some ridiculous ratios in the schools. I mean, and of course you guys end up providing kind of an additional layer of support. But please don't hesitate. Encourage your kids to reach out to counselors, reach out to teachers. There are lots and lots of services out there all throughout the community. We're going to be posting some resources on our website in addition to this webinar, so that we can just encourage people to go get help if they have anything that they need. And I hope that you'll all be willing to engage with some of our participants in the future if they've got questions about how they can help their kids weather through some of the challenges of teenagehood. So
Absolutely.
thank you, everyone. Thank you for being a part of this. Thank you for everyone for participating. And with that, I'm going to go talk mental health with our school superintendents.
All right.
So, thank you, everybody. Appreciate it.
All right.
Thank you.
Bye.
Good evening.